Howdy and welcome to the Confidence Through Health podcast. I'm Jerry Snider. As an elite level athlete, owner of All In Health and Wellness, and author of the book Confidence Through Health, my goal is to help you achieve your goals and dreams using health as the conduit to get there. I want to say thank you to Social Media Cowboys for sponsoring this week's episode of the Confidence Through Health podcast. If you need help with a website, if you need social media needs for your business, if you need help with AdWords, SEO, all those things that you know you should be doing but you are too busy to do or you're too confused about, they are the experts that you need in your corner. If you're interested in launching a podcast such as mine, they help me edit my podcast and do a fantastic job making sure that all of the technical side of it is handled and we launch a nice, neat, edited podcast episode each week. So I want to thank Social Media Cowboys for their continued sponsorship of the Confidence Through Health podcast. You can find them at socialmediacowboys.com, or you can find them as well with other sponsors at confidencethroughhealth.com. Howdy and welcome back to the Confidence Through Health podcast. This is episode 124, and I want to talk about comparing your health to other things that you spend money on. We all in the Western civilized world like to spend money on things, right? It's like part of what we feel like is freedom for some of us is to be able to spend money on things that we want, not necessarily things we need. That we'll spend money on those too, but that we have the freedom to be able to spend money on things that we want, that we desire, that we think are going to bring us happiness, that may bring us happiness. I'm not going to judge you on what you're spending money on, but more of what, hopefully make you realize that a lot of us are not spending money on the thing that is most important. And we're not spending enough money, or we're not focused on it enough. It's not high enough up the priority list because it's not necessarily something that we spend a big chunk of money on all the time. It's just little bitty chunks of money that add up over time to be, quite honestly, the most expensive thing you will ever purchase in your entire life. So what that thing is, obviously, if I'm talking about it on a podcast, it's called Confidence Through Health. Probably has to do with your health, right? Yep. So it is your health. What you spend money on in regards to your health is the most expensive thing you will spend money on for your entire life. And just to put those numbers in, give you a visual, my finances. So if I go back to January 1 of 2000, and I've kept a pretty detailed list of my finances from that point. I use Quicken. It's not necessarily you can use whatever program you want, but that's the program that I use to track things. And so I've got a history all the way back to, actually goes back to 98, but I just picked 2000 because it seemed like a good, even place to start. My wife and I got married in 2000. So a couple of months in there, it's just me. But after that, it's the two of us. And then once our kids came along in 2009, 2011, then now it's four of us. So this isn't just my number, but it's what we spend on as a family. But it's still a high enough number. So and these are just the top categories that I picked. It's not even everything that we spend on in regards to our health. And it's not just the things like your health insurance and your doctor's visits. It's not just your physical health piece, but also some of your mental health pieces. What are you doing to make sure that your mental health is staying at a high level? That you're doing the right things to take care of yourself all the way around, not just the physical body, but how are you taking care of your whole system? And so to run through the numbers real quick, and these are, I rounded these up, so it's not the exact number. I rounded them up for ease. So health insurance.
health insurance, we have spent in a little over 11 years. No, sorry. I don't know where I went with that. I went back to 2000. So this is a little over 21 years. A little over 21 years. We have spent $100,000 in health insurance. So if you think about that, when we bought our house in 2002, it was valued. Well, I should say not valued, but it was our purchase price was under $100,000. Now it's valued at a lot more than that because of the housing market that's changed in 20 years. But we bought our house for less than $100,000. And that's what we spent on health insurance in 21 years. That's a lot of money. But when you do it little bits by little bits by little bits, it doesn't seem like a lot, right? Groceries, $165,000 in groceries. Does it cost a lot to eat healthy? Yeah. I mean, depends on how you view it. It doesn't really. And I'll tell you why. Dining out, $49,000. Spread over 21 years. That's not a lot. That's really not a lot. Medical, $54,000. And that includes some pretty hefty incidences. My wife had to have surgery. I've had to have surgery twice, 3 times. Yeah, 3 times. So that's not just our average doctor's visit, but that includes, 4 surgeries for the adults. My son had to have tubes put in. My daughter had her tonsils taken out. So there's multiple incidences. But here's the thing. If you look at statistics, each person is statistically, the chances are you're going to have a major medical incident every 10 years. So chances are if you haven't had one, well, then you're going to have multiple coming up. If you fall in line with statistics, which most of us do, because that's why they keep those statistics. And that's why they judge health insurance premiums off of and all of those things, because they always line up. Personal care. So here's where it comes into the mental side of it, personal care. So this is everything from haircuts to getting nails done, pedicures, massages, all of the stuff that goes into taking care of your well-being, right? So $18,000. You might say, golly, dude, you're not spending a lot on that. But we also break out some of our stuff, the way we look at it, into recreation, because there's a lot of stuff that we do that's personal care, but it can fall into recreation. And so we do that. So $49,000 in recreation. So we're spending a lot of money on making sure that our headspace is correct. So just that 1, 2, 3, 4, 5, 6 categories that I looked at. There's obviously more than that, but those are the 6 categories I looked at in order to take care of our bodies and to take care of our health, overall health. We have spent $435,000 on in the last 21 years. 21 years, $435,000. Like I said, the $100,000 in health insurance over that time period is more than what we paid, what we bought, the purchase price of our house. And most people will tell you, most financial advisors, most bankers, anybody that's in the financial world will tell you that your house, on average, the house is the most expensive purchase you will make in your lifetime. Buying a house. So that just goes to show, and by the way, we haven't paid off our house. And if we would have spent that $435 on housing, we would have paid for the house 4 times plus. Of course, we didn't have it all at one time. And so that's where it's these adding things up. But in just that time period, of 21 years in what typically should be some of the healthiest years of your life, from your mid-20s to your mid-40s. So that should be. Now, statistics are skewing as we get further and further into the obesity issues that we have in our country, the overweight issues we have in our country, the chronic disease issues we have in our country, the poor nutrition issues we have in our country. As we get further and further into that range of when you're the healthiest is actually shortening. And so it's no longer going into your mid-40s. But those should be some of the healthiest years of your life. And we spent almost $500,000 on our health for a family of 4 that wasn't really a family of 4 for that whole time period even. So you average it out, it's like roughly 3 people for that time period. Like I said, 6 surgeries. If you take care of yourself and you spend the money on taking care of yourself, we have set ourselves up, because we've done that, to hopefully, at least for my wife and I, because my kids are still young, so they can still make decisions on their own when they become 18, and they can still change things in their path. But my wife and I hopefully are making decisions that we're going to be able to live into our 80s, 90s, and beyond. And that those years are not going to drain us on a health standpoint financially, because we're spending the money now in the right areas. Like, the number one area is groceries. And it's not because the price of groceries has gone up, which it has. But we spent more money on groceries than anything else. And there's a lot of people out there that that's not the case. They've spent more money on dining out. They've spent more money on medical. They've spent more money on health insurance because their health insurance premiums are so high, they can't avoid it just in order to have it. I'm not saying those things are wrong necessarily. Maybe the dining out, if your dining out is more than your groceries, that's probably an indication that you've got an issue, because most places you eat when you eat out are not going to provide the healthiest options. So it's just a little snippet that shows how much money you're spending on things that pertain to your body and your health. And that it's not just an oversight. It's not something that you should be thinking, oh, I'll take care of it when the kids are grown, or I'll take care of it after mom and dad pass away and I get some of their, the money that they leave me, the inheritance that they leave me, and I'll be able to use that to be able to take care of my health and start over. Or I'm going to wait till I retire and then I'll take better care of my health. Because it's compounding against you if you're doing things that are not healthy. They're compounding against you over time, and you're going to get to a point, your body, the systems in your body, the organs in your body, the cells in your body, they will get to a point where if you treat them badly enough, they will not be able to come back. They will not be able to get back to where you were healthy. They can get back some, but they won't be able to get back all the way there. If you mistreat them and it's the way it works. Somebody has a heart attack because they've cut off blood to a part of their heart. The heart attack is a symptom, a sign saying, I'm not getting blood to this part of my heart. You need to do something. And if you don't do something quick enough, that part of the heart dies. It's not coming back. So do the things now to take care of your health. Spend a little bit more now on things that are going to affect your health in a positive way. And you're going to save money later, because your health is the most expensive thing that you are ever going to spend money on. The most expensive thing you will ever spend money on, unless you are in the 0.001% of people out there who are buying an island for $4 billion, or trying to fly to Mars and spending umpteen billions of dollars trying to get there. Unless you're one of those people, yeah, you may spend more money on something else than you will on your health. But remember, those people that have that much money and are doing those things are also going out to eat and spending $4 or $5 or $10,000 on one dinner. So it's skewing that number too. So you got to remember that. But for the average person in a Western civilized world, and that's you and me, you will by far spend more money on your health than on anything else. And when I look at the report, you might say, okay, well, you're telling me all the health things that you spent money on. What about all the other things that are out there? Like, you're not telling me how much you spent on the other stuff so I can compare it, right? So here's the other stuff. On taxes, we paid in. This isn't just what we reported on our tax report, but this is like from the paychecks that was paid in, $105,000. So we spent more on groceries than we did on taxes, right? Fuel, $65,000. So it's a little bit more than what we spent on medical by itself. Utilities, $45,000. Automotive. Okay. Now, this includes buying cars. We've had multiple cars, servicing the cars, right? So all those things, automotive, $117,000. Still less than groceries. So we spend more on just groceries for ourselves. So if you compare groceries to fuel, right? Because fuel is for your car, groceries goes into your body, takes care of your body, fuels your body. We spend $100,000 more on our bodies than we did on our cars. So is the car more fuel efficient? For some people, car's going to be more fuel efficient than your body is. Car's not going to break down as much as your body will. So as a whole, though, $435,000 in just those 6 categories that we've spent on our overall health and well-being and wellness far outweighs any other combination of anything that we've purchased, whether it's our house, our cars. Now we can, everything we've ever spent money on, everything else minus the health category, then everything else is combined is going to be more. But if you break it up by category, however you categorize it, health is going to be the most expensive. Your health and wellness is the thing that you're going to spend the most money on. So where you spend that money is hugely important, because you really want to spend the money on your groceries, on the food and the stuff that's going in, on your recreation, on your personal care. You really want to spend the money there so that later in life, you don't have to spend the money on the medical bills and the health insurance premiums that are out of control because you're not fitting into their matrix to be able to say you get a good premium. So by far, we spend more money on our health than anything else. It's just on little bits here and there. And it's such little bits here and there that most people don't understand how much they are actually spending on their bodies, whether it's for good health or bad health. Most people don't understand how much money is going towards that. And when you look at that, and you say, the average bypass surgery, you're looking at $250,000 to $400,000 for one surgery. Save your life, totally worth it. If you're in that position, totally worth it. Can it be avoided? 100% can be avoided. But think about that, $400,000. If you live in a house that's valued at $250,000, and a lot of that $400,000, by the way, is not covered by insurance. So that's coming from somewhere, because the doctor's going to get paid, the hospital's going to get paid, all the nurses are going to get paid, all the medical device companies that had to do something with your bypass surgery are going to get paid. All these insurance companies are going to get paid. All these people are going to get paid. It's got to come from somewhere, right? So you're spending money on your health. You might as well spend it in the right place. So take some time to figure out where the right places are. Go back and listen to my episodes. I talk about that. I talk about how to eat properly. I talk about where to spend your money on, what types of foods to eat, what types of exercise to do. It's not as expensive as you think. $435,000 over 21 years. That's not a lot of money per year to be able to maintain health if you know where to spend it. So it's a big key. It's a big key to understanding. And I would much rather spend an extra $15, if even that much, in healthy groceries now, a week, to be able to avoid a $400,000 incident, or even a $250,000 incident, or having a stent put in for $40,000 or $50,000 or more, or being on diabetes medication for the rest of my life. You know, insulin's not cheap. Go ask somebody that's on it. Insulin's not cheap. So I'd rather spend that money now and not have to spend it later, and be in a position where if I don't get it and I don't have the money to spend it, I'm going to suffer dire consequences with my health. Because right now, if you're in your 20s to 40s, you may not be having any consequences that are showing themselves up. They may be brewing underneath the surface, but they're not showing themselves yet. And so it's easy to say, I don't have to do that yet because I don't feel bad. I don't have these issues. I don't have those things. I'll be able to fix it later when it happens, but it's brewing underneath the surface. It is really hard to overcome once it gets past that point where it breaks through and you see the symptoms. Then it's been going on for way too long. So spend your money with your health in the right places now to avoid having to spend it on life-saving things later. I'm not saying don't save your life. I'm not saying that, but there's certain life-saving things that happen later in life that you can avoid completely. They can be completely avoided if you take care of your health now.
Thanks for checking out the All in Health and Wellness Confidence Through Health podcast. Our goal is to use health as a conduit to help you reach your goals in life.
A little lighter than me. I'm about to black out. Her grip is getting tighter on me. I think I like it deep inside. I feel the fire in me. She like the milky, see me creaming to the coffee to me. She got soul in her sway.